Up next, Abdul El-Sayed joins the Authentically Detroit candidate series to share why he's running for the U.S. Senate. Keep it locked. Authentically Detroit starts after these messages.
Have you ever dreamed of being on the airwaves? Well, the Authentically Detroit Podcast Network is here to make those dreams come true. Formerly known as the Deep Network and located inside the Stoudemire, the Authentically Detroit Podcast Network offers studio space and production staff to help get your idea off of the ground. Just visit authenticallydet.com and send a request through the contact page. Interested in renting space for corporate events, meetings, conferences, social events, or resource fairs? The MASH Detroit Small Business Hub is a 6,000 square feet space available for members, residents, and businesses and organizations. To learn more about rental options at MASH Detroit, contact Nicole Perry at nperry@ecn-detroit.org or 313-331-3485.
Hey, y'all, it's Orlando. We just want to let you know that the views and opinions expressed during this podcast episode are those of the co-hosts and guests and not their sponsoring institutions. Now, let's start the show.
Hello, Detroit and the world. Welcome to another episode of Authentically Detroit, broadcasting live from Detroit's east side at the Stoudemire Wellness Hub inside of the Eastside Community Network headquarters. I'm Donna Givens-Davidson. Thank you for listening in and supporting our efforts to build a platform of authentic voices for real people in the city of Detroit. We want you to like, rate, and subscribe to our podcast on all platforms. Welcome back to the Authentically Detroit Candidate Series. Today I'm here with Abdul El-Sayed discussing his candidacy for U.S. Senate. Orlando is out of town today, so it'll just be the two of us. Abdul El-Sayed wasn't supposed to be a politician. He studied to be a doctor, but realized it was our broken politics that was making people sick. Abdul is running for U.S. Senate because life in Michigan shouldn't be this hard or this expensive. After a successful career of making government work for Michiganders, he wants to take his vision to Washington and make the United States Senate work for you. Abdul rebuilt a government agency to make it actually work, and then he did it again. He rebuilt Detroit's health department after bankruptcy. Then he restructured Wayne County's Department of Health, Human, and Veteran Services, serving 1.8 million Michiganders in the state's largest and most diverse county. As a public servant, Abdul secured free glasses for kids who needed them, removed lead from Detroit's elementary schools, took on Michigan's biggest polluters, and made life-saving Narcan universally accessible. He also spearheaded a program that will cancel up to $700 million in medical debt for 300,000 Michiganders over 2 years. His work earned him recognition as a Public Official of the Year by the Michigan LCV and a spot on Crain's Detroit Business 40 Under 40 list. He was born and raised in Southeast Michigan and proudly attended public schools where he captained his high school football, wrestling, and lacrosse teams. Abdul was raised by his father, Mohamed, an Egyptian immigrant, and his stepmom, Jackie, whose family has lived in Gratiot County, Michigan, since the 1800s. He graduated from the University of Michigan with the highest distinction and played on the Wolverines men's lacrosse team. Abdul earned his medical degree from Columbia University on an NIH-funded fellowship and a second doctorate at Oxford University as a Rhodes Scholar. Abdul lives in Ann Arbor with his wife, Sarah, and their two brilliant young daughters, Emily and Serene. He's been a card-carrying union member of AFT Local 477 and 6244, SEIU Local 500, the National Writers Union, and the AAUP. Abdul, welcome once again to Authentically Detroit. This is not your first time with us.
Ms. Donna, it's always a privilege to get to join you. I'm grateful to be here. Thank you so much.
All right, so how is this blessed day finding you?
Finds me well. I just got here from a protest held by the OPEIU local against McLaren-Macomb, and I got the privilege to walk with nurses and support professionals who are fighting for safe staffing. And for me, that fight is personal. As you just read, I trained as a physician, and I know the critical work that nurses and certainly support professionals offer to our patients across our state. And so the opportunity to stand with them in their time of need when they're fighting for both a safer working environment for them, but then let's not forget, when nurses fight for safer working environments, they are fighting for safer healthcare environments for the rest of us. So it was a real privilege, and I'm honored to have been able to walk with them and also inspired by their leadership.
Yeah, I think we can't say enough great things about nurses. My late sister was a nurse, and very proud of it. One thing I observed in seeing family members hospitalized is the amount of care nurses provide. Nurses really provide the care for sick people. Doctors provide the instructions and the diagnosis and the oversight of that care. But it's that day-to-day stuff with the nurses that makes a difference. And I've been in situations, especially during the pandemic when my mother was hospitalized, where I could see the impact on nurses, not having enough nurses on the patient health. So it's a great fight to be in.
It is. And my grandmother was a nurse, and my mother is a nurse. And their work has been about, like you said, providing the actual care. And you learn that in med school, is that you get to show up and make a set of decisions that will guide a person's health care. But the folks who are showing up for them day to day, right, who are making sure that their pain is taken care of, their needs are met, those are the nurses. And then there's all kinds of staff who work hospitals who make healthcare possible. And sometimes we forget about them. I'll never forget the folks that we call one-to-ones, right? And their job is to monitor patients who need one-on-one monitoring. That's a really tough job, right? Yeah. Because most of the time when somebody needs one-on-one monitoring, it's a situation of life and death. And, we somewhat take them for granted. They don't have one of those titles that you think about, but they're part of the connective tissue that makes a hospital run. And in this particular circumstance, right, this hospital's barely paying these folks a living wage. Wow. They're Medicaid eligible. At least they would have been Medicaid eligible before.
Not the nurses.
No, I'm talking about the
one-to-ones.
The one-to-ones.
Yes.
Yeah. And you got to imagine you show up to work every day and you're still Medicaid eligible, right? You should be able to, in the richest, most powerful country in the world, show up to provide necessary health care and know that you're going to be able to get paid a living wage to provide for your family. And the fact that that's not possible in any context in America is exactly the problem.
Exactly. I mean, we shouldn't even have Medicaid. We should have Medicare for all, universal health care, so that it shouldn't matter where you work. I think we have this mindset that only certain people deserve quality of life. Only certain people deserve housing and water and health care and clean environments, and yet these feel like human rights to me that we should all be fighting for the least of us in terms of our social standing so that all of us live better.
Ms. Donna, I really appreciate you saying that because I think one of the most impactful aspects of my upbringing was that I spent a lot of my childhood summers in Egypt, where my family immigrated from. And I got to meet all my cousins who were just as smart, just as capable as me. They didn't get to live the lives that I got to live. And a lot of that had less to do with how hard you work or how smart you are, had everything to do with opportunities you've got. And the crazy thing for me is that when I'd go to Egypt and come back, I'd travel 15 hours either way, and I'd travel about 10 years difference in life expectancy. I grew up in Oakland County. I could go 15 minutes and cross the same gap.
Yeah.
And the crazy thing is that kind of chasm exists in our country. And it exists whether you go 15 minutes from Oakland County to Detroit, or you go 5 hours north from the city of Detroit into, you name the rural part of the state.
No, there's parts of the rural parts of Michigan that I would never want to live in. I think we look at Detroit as being the most deprived part of the state. My rule of thumb is how many dollar stores exist in your community. How many people in this community are shopping and buying food inside of a dollar store? And there's all kinds of places in rural Michigan where that's it. There's no fresh grocery stores. I think it's really tragic. I think we become so aware of our own pain and suffering that we don't realize that people are underhoused in rural communities and suburban communities. The myth that America is this wealthy nation where most people are doing well is simply that. It's a myth, isn't it?
It is. And the crazy thing about it is our current political system, it thrives on keeping us apart.
Yeah.
And one group tells another group that the reason you don't have is because of them over there, and vice versa. And what we're trying to do, I was up north in Antrim County. I'm going out west this week later on. What I'm trying to do is be a bridge that connects folks across the challenges and the pain of living in America in 2025, right? Because if you are working or retired or unable to work in Detroit or in Flint or in Oscoda, you're experiencing the same set of challenges. It's hard to afford a second bag of groceries. It's hard to see a doctor without worrying about medical debt. It is hard to take a big deep breath of air or drink water, right? Here we talk about, or in Flint, you talk about lead. Here we're talking about water affordability. There they're talking about PFAS. All of these challenges are one and the same, and we have an opportunity to help folks see that if actually all of us are willing to come together around a movement of working people, there's an opportunity to come together to actually rebuild and fight for the kind of government we need and deserve.
Absolutely. I think that what you're doing is, I'll say it's God's work, right? Connecting people and helping people see each other as human, especially in this divided state of our nation where everybody is against everybody. We had here a few weeks ago, I don't know how long ago it was, a couple weeks ago, we had a unity breakfast, trying to bring together people from all different, groups, whether you are Jewish or Muslim or Hispanic or LGBT or disabled or Black. Why aren't we working together towards a shared justice? Justice can't be for one group of people. And one thing I've been thinking about lately is the way our civil rights are taught in schools. Civil rights, when you look at the civil rights movement, you look at the movement for Black people being treated as human. But civil rights are the rights of women being treated as human. Civil rights are the rights of people who are from different backgrounds being treated as human. Everybody deserves those rights. And so it's interesting to me to really witness how civil rights is not one thing, it's all of it, right?
Yeah.
And there's been multiple civil rights movements since before this nation was founded, with people saying, I have the right to, basic freedoms. I have the right to jobs. I have the right to have a banking account. I have the right to be treated as human. If we saw that this is all civil rights and that we either have them or we don't. On my way here, I was talking to one of our interns, Cedric, and he was talking about how, fascism sort of develops from people taking away rights little by little by little, and then you have a dictatorship. But, thinking through also how me turning my blind eye to your rights being taken away threatens mine.
Right. When you hear the word rights, usually the other word that comes with that is responsibilities. And I think we're really good at showing up for our own civil rights. But there's a second side of that, which is how do you show up for other folks? And I think there's a civil rights and there's a civil responsibilities. I think part of that is the willingness for all of us to show up for one another's fights, right? Securing, like you were talking about, securing my rights is in part my showing up for you to help you secure your rights. And I think it's that civil rights and civil responsibilities piece of it that I think can be profoundly powerful when we're willing to see our rights as connected to one another across the different boundaries they tell us that we cannot bridge and we cannot step over. And I think there's an opportunity here to be thinking together, especially in a moment where you see the impending fascism of this moment trying to come for all of us, not to be tricked into thinking that when they come for somebody else, they're not coming for you too.
But there's a lot of anger.
There is.
And there's a lot of anger and there's a lot of blame. So during the same breakfast, there were a couple people who said, listen, I need to hold the people who voted for Trump accountable. Not just those people, but the groups of people who are part of the same group. They need to be held accountable. So Muslim people need to be held accountable for Donald Trump being made president because Muslim people put him there. And Hispanic people need to be held accountable, and white women need to be held accountable. And there's this accountability mindset. We want people to be punished for making bad decisions, even if those weren't decisions they made. Like every Muslim in America did not vote for, some of them voted for, why are we assigning group responsibility? And it makes it easy. And so it really interesting was hearing some of the people who were in the room saying, wait a minute, I'm from this group and I'm upset too. What are you talking about? This was not done for me. The way that the news media, I think, perpetuates these narratives is really harmful. So I'm interested in hearing your approach.
Yeah.
You want to go across the state. As you know, like a certain ex-president, your name does not necessarily generate instant trust and receptivity. How do you deal with that?
Yeah, just on that note, which is really fascinating, right? For a lot of my life, as long as I've been in the public eye, I have felt the responsibility to speak on behalf of people who look like me or have names like mine or pray like I do. And I've had a very intense relationship to that because I don't speak for all Muslims. And in the last election, I endorsed Kamala Harris. I was the first Arab and Muslim leader to do it, not because I agreed with the administration's position on Gaza. In fact, I had endorsed the uncommitted movement before that. But because if you look at the election from the eyes of a child in either Gaza or Detroit or Oscoda, there's no world in which Trump would have been better. And so I tried to do the right thing. It's been fascinating sort of watching exactly this conversation of saying, well, your community did X, Y, and Z. And you're like, well, despite me, right? Because I was trying to help. But also that same sort of logic applies, which is that sense of saying, okay, so how much does any one person represent a community from which they come? And what's been fascinating to me is as I've traveled the state, I was in Petoskey last week. A lot of folks are particularly interested in what you have to say if you're uncommon and you come from an uncommon background. And I come from an uncommon background, right? And I come from an uncommon background, whether I'm talking to a community of Arabs and Muslims, because I was raised in a household that was half Egyptian, half white, or I'm uncommon in a community like Petoskey, where I probably contributed to half the melanin in the room. And so if you ask yourself the question of, all right, what does it mean to try to explain us to us rather than me to you, or try and get you to see me, but how do I actually explain the human condition beyond? There's actually a really unique opportunity you have, because the minute that people see you talking about the challenges that they face from your background, you've instantaneously, right? You've crossed the whole chasm that they might have in their mind put between you. And what's an amazing thing about having been sort of a student of people who are maybe not like me, right? Because I've had to be my whole life, because there was never a room in which everybody was just like me, is that you start to realize that the things that we love the most or the things that we fear the most tend to be the same. And if you can bring folks to see the things we love the most and hope for the most as the antidote to the things that we fear the most, I think there's an opportunity to start bringing the people together. And that's what our movement, that's what this work is about.
It's interesting when you refer to yourself as Arab, because many people would see you as African because you come from Egypt. Yeah. And I think that sometimes there's this feeling that Egypt has been separated. I mean, Ta-Nehisi Coates, I don't know if you read his most recent book, goes into great detail about how Egypt has been robbed of its African influence and Africanness. And, one of the challenges I see is a lot of Black people feeling rejected, or as though people are distancing themselves from them. And so therefore it's like, you don't love me, I don't love you back. Yeah. You can't speak for me. And you saw that happen in New York City, right?
Yeah, you did.
Because if people have to, most Black people in New York City voted for Cuomo.
Yeah.
Now, I wouldn't have, but most people who are Black in my age would have, right? Yeah. Or did. And I can't remember.
I think Mamdani won the 29-year-old group, but that's okay.
He did. He won the younger group, right?
Which I'm counting you among.
Yes, but. You can absolutely count me among. I will be 21 plus 33, 29 plus 33. What's that math? Yes, in September. But no, I think that...
Those other 33 don't count.
No, they don't. I just keep on repeating my 29th birthday, Groundhog Day, until I get it right.
Well done.
One day I'll get it right. But
trying to live your best 29.
You've
just had 30-some tries at it.
I don't know if you know Gail Perry Mason. She has that, I think it was Forever 39 thing. Yes. I thought it was 39, but now I'm 29. Anyway, but you see that. And I'm sitting here on the other side of this thinking, wow, these are my people who would not vote for Mamdani, even though I think he stood for everything I stand for. And his mother made Mississippi masala. Mm-hmm. So how can I not love her, right? It's like, great movie. But I think that people make the assumption about him that he doesn't care about us. Do you think that's true? And what is the evidence that he has bridged those gaps? Also, speaking to you, how are you bridging those gaps in Michigan so that Black voters can see themselves in you?
Yeah, I'm proud of my African heritage, and I'm proud to be both in the spirit of authenticity, authentically African and authentically Arab. And yes, there are many countries where people are both authentically African and authentically Arab. And, it's a wild thing. The concept of race doesn't really exist in Egypt, because depending upon where you go, people look all kinds of different ways and they're all Egyptian. My dad tells the story of his own experience meeting a friend of his he had not seen for decades. They went to engineering school together, and his friend, whose name was Hamdi, moved to Nebraska. My dad moved to Michigan. And they didn't really see each other until they ran into each other at a conference. And they reconnected, and they were so excited to see each other. And my dad has curly hair, but it's less curly than his friend Hamdi, who is more Nubian, right? All of us have some Nubian ancestry and some Greek ancestry, because Egypt was this melting pot of like Africa, Asia, Europe. And my dad looks at his friend, he's like, Hamdi, you're black. And Hamdi's like, I know. And the idea was that they had never registered this idea of race until they had lived in America for decades and then had to self-identify around some sort of racial hierarchy. And so if you were to meet my grandmother looks a lot like you, right? And a lot of folks, if she was in America, would say she's black, right? But like me, because of the texture of my hair, right, would be categorized as white. But then my blood is 100% African. And so these things were like foisted on us in a caricature of where people come from that is not quite accurate. And Egypt breaks all those molds, right? Because Egypt is a jewel of African culture and history, and also a crossroads for Arab culture and history, and also the gateway from Africa into both Europe and Asia. All of those things are true.
I really appreciate that explanation. Thank you for sharing. So going back to Mandami, who is Ugandan, right? Yeah. So another example, he's Ugandan and Indian. But black people see him as many black people don't see him as one of theirs or as being connected to their cause. What do you know about his background, and why do you think that might be?
I don't know as much about his background. I know there's a very large South Asian diaspora in a lot of parts of sub-Saharan Africa, and I know he was born in Uganda. And
Kash Patel was as well, right?
That's right. Right. And I can't speak specifically to how he identifies or how he thinks of himself. But I can say that, there is a lot of pride for folks who spent time on the continent in being authentically African. What I will tell you is in my work, racial equity has been fundamental to the work that I've tried to pursue my whole career. As a professor, when I taught before I came to the city of Detroit, my work was focused on racial and ethnic disparities in adverse birth outcomes. So things like preterm birth and low birth weight and infant mortality. And then it was a point of immense pride to get to serve this city as a health director who got to rebuild the health department around taking on deep inequities that we faced. And in my role in Wayne County, the same applies. And at the same time, often in my engagement with the community, I have found myself trying to be as humble about understanding that many people who come from an ethnic background that I share have not had the same humility for the experience of Detroiters and Black Detroiters in particular. And I think there is a history that a lot of folks will point to that unfortunately folks from immigrant backgrounds have sometimes seen Black communities as an opportunity to be tread upon rather than a community to build with.
Yeah, we're going to take a break. And when we come back, I want to explore that a little bit further, talk about your work at the Detroit Health Department when I met you, and then your plans for Senate.
Absolutely.
About how you have people come to America, right? And they look down on Black Americans, not just Arabs, not just Asians, not just white people from Europe, but people who are from Black Africa come here and look down on Black Americans and don't necessarily have a sense of connectedness to them. Not all people, but many people do. What do you think that's about, and how do you see your ability to bridge some of those divides? Because I think right now, lately, there's been, Black America First movements, American descendants of slavery movements, all of these things in reaction to this feeling of being looked down upon by the entire world.
Yeah. I think part of it is the confusion of poverty and oppression. And I think for a lot of folks from immigrant backgrounds, they say, well, I was really poor when I came and I was able to build out. And my point to them would always, yes, you had very few material resources and you came as the top student of your class with an opportunity to go to graduate school, right? And you're confusing money and capital for socioeconomic position.
And also racism.
Exactly, yes.
And also racism because you came here and you were not necessarily looked at as unbankable,
Right.
as untouchable, as undesirable in this neighborhood, in this job. And so I think that the stigma that Blackness carries impacts everything in the criminal justice system. People don't understand that racism actually operates separately. Many African people, I was talking about this with my son-in-law, and his dad is is Nigerian. And in talking to him, he didn't realize he was Black until he was in America living. I forget where he realized he was Black. And, my son-in-law was like, "You didn't know you were Black?" And he's like, "No, I knew that I was African, but that same experience that your dad had, his father had coming here, even from Nigeria, understanding how racism really operates." And it takes time for people to do that.
That and also the way racism compounds.
Yes.
Right? It shapes the future opportunities of generations, right? And that compounding takes away opportunity from the get. And I think, for me, a lot of my race and frankly, class conscious came out of trying to explain to myself the experience of being Arab and Muslim post 9/11 and the deep and profound poverty of the family that my father escaped when he got the opportunity through an education to come here. And in a lot of ways, it was reading Malcolm, it was reading Martin, it was understanding the ways and the forces that have often tried to rob generations of Black American folk of opportunities and then blame them for the opportunity set that they had, and then to leverage that blame to create public policy that compounds that blame, whether that's replicated at the local level or the state level or the federal level, and then the ways that those things intermix. And so in a lot of ways for me, the work that I do and the work that I've done has been about trying to ask, what role can I play in taking on a profound injustice, right? As somebody who is humbly stepping into partnership with Black communities to ask, given what I've got, how do I bring it here? And we can use this together to create opportunity and try and dismantle some of that structural compounding of the way that racism shapes poverty.
So let's talk about the Detroit Health Department.
Yeah.
When I met you, you were director of the Detroit Health Department, and you didn't bring it back from bankruptcy. You brought it back from Dave Bing because the Detroit Health Department was dismantled under his leadership. And I think it was the Institute for Population Health that took much of the work of the health department. We didn't have a health department even before the bankruptcy, and which was devastating to me because my first job was with the Detroit Health Department and affiliated with the Detroit Health Department. My mother worked for the health department as a social worker for the AIDS Project. She was the social worker for the AIDS Project. And I worked for an offshoot, the Community Health Awareness Group. And so that's my career background.
Yeah. We stand on the shoulders of giants.
Yes. So I was at Herman Kiefer, right?
Yeah.
I was at the old Herman Kiefer. So you came and you had to resurrect that.
There was so much to build from. I don't want to be clear, right? It's like people with the lived experience of having gone to Herman Kiefer. I remember meeting a gentleman. I was actually eating dinner, and he was unhoused, and he asked me for some money, and we got to talking. I bought him dinner, so we sat down, had a meal together, and he asked me what I did. This was like one of my first couple of months in Detroit. I told him I worked at the health department. He's like, "Oh, Herman Kiefer." I was like, "Unfortunately, Herman Kiefer shut down." But yes, that health department. He's like, "You know what my mom used to tell me?" I was like, "What's that?" She used to leave me with $5 in my pocket, and she said, "If anything goes wrong, you get yourself to Herman Kiefer. They'll take care of you."
Wow.
And so that was the culture of that department in the city. And so our job was to work with folks to try and build on that foundation, that collective memory of what this thing was supposed to be. The other part of it, though, is we needed a thesis for where do you get started, right? Like I walked into the back of the municipal parking department. We had about 150 people working in a gigantic room in the back of that department, and we needed to create some coherence around it. And so we actually started to think very critically about what is the opportunity for us here that is unique in this particular city to help this department be an engine to try and disrupt the way that racism works and structural racism works intergenerationally. And it led us to doing things like building a program to guarantee free glasses for kids. Because we found that 30% of our kids would test positive for vision deficits, come back testing positive again next year, meaning we knew they needed glasses. They just didn't get a pair of glasses. And it doesn't matter what's happening at your school board if you cannot see what's happening in the front of the class. And so we set about to solving that problem. Another big challenge, asthma.
Well, a question. So if you need glasses and you don't have them, then that can be interpreted as an intellectual deficit,
Yes.
right? And
Yes.
so many of our kids are misdiagnosed as having intellectual deficits. I wanted to pause right there because that simple thing helps close the learning gap.
Yes. Now I'll tell you a story. I was giving a lecture at the University of Michigan, a public health course, intro public health course. This young woman was wearing this very bright pair of red glasses. I'll never forget them with gold stars. And I was like, that's a fashion choice. And so I finished my lecture. She waited to the very end. And she's like, do you see my glasses? I was like, yeah, I see your glasses. And she's like, well, I got these my freshman year. And before then, I just thought I was dumb. And I got these glasses, and now I'm a freshman at the University of Michigan, and I work on air quality in Detroit. That's what I want to work on in my life.
Wow, that's awesome.
And so exactly to your point, right? Like you interpret a kid who, and this is the problem. Like if you've never known you needed glasses, then it's not like you know that the thing you're seeing isn't crisp and clear. You just think that's how everybody else sees it. And so I've literally seen a kid put on a pair of glasses, look at their hand, and then get a little bit afraid that their hand has wrinkles in it.
Oh, wow.
Because they've never seen the wrinkles in their hand. And so that's the impact. And now all of a sudden you go from, I can barely see the blackboard to, oh, wow, actually all of these things make sense, not because my mind couldn't comprehend them, but because my eyes couldn't see them. And so it does change a kid's self-conception.
So you worked on glasses, you worked on dentistry.
Worked on glasses. We helped to upgrade access to dentistry for kids in particular. One of the big things we took on was air quality. And asthma exacerbation is actually a principal reason why kids miss school. So a kid with even persistent, moderate asthma will miss on average about a day a week, right? Because they can't breathe. And so one of the big things we started to work on was air quality with the key goal of taking on some of the biggest polluters in our city, in large part because who
were you taking on?
Well, the Marathon Petroleum Refinery. They and I
Southwest Detroit.
Yeah, in Southwest Detroit. So they're the biggest polluter in the most polluted zip code in the entire state.
They say that, but that's also the zip code that's tested.
Yes,
the challenge is
that's
the EPA came here a couple of years
Right.
ago and said, we have not done any real monitoring of what's happening here. We had a whole incinerator here. And the highest asthma rates are actually right over here, 4213, 4214, and 4215, the highest asthma rates in the state. And so there's also this concern I have that, what gets tested gets treated.
Gets treated.
But there's very little advocacy for what's happening here. And you can see, when you worked at the health department, the first time you came here, you weren't looking at that factory behind us, that new Stellantis factory, which
Didn't
has
exist.
polluted. And the mayor actually allowed or facilitated, this administration facilitated the destruction of the Kiner Creek Greenway, which buffered the pollution in the adjacent neighborhood and the adjacent school. They put up a wall with a mural on it and said, well, this will protect you, I suppose.
Yeah.
But then there's been multiple air quality violations, and they rezoned that buffer, M5.
Yep.
M4 rather, intensive industrial, which is not supposed to happen next to residential.
Nope.
And so it feels like there's nobody fighting for us right now.
And Donna, that's exactly the challenge. So that's one of the big reasons while I was at Wayne County, most recently, we put up an air quality monitoring system where we've got 100 air quality monitors across the county. And that's exactly the point, is that we haven't been systematically measuring, and the EPA's measurements are few and far between. So it's very difficult to actually get high quality data with the level of inference that you need to be able to identify who is actually getting hit hardest. And so that work sort of evolved into saying, well, we know that Marathon is a problem in Southwest Detroit.
And by the way, there's a horrible problem. I'm not trying to minimize that.
No, but also to your point is, what problems are we not measuring? Right. Mm-hmm. And so we said, okay, well, we can build a unit where we can start measuring everything at a level of detail, right? Working with a local entrepreneur, right, to put this program together. Right.
Who did you work with?
So Darren Riley at Just Air. So it's a local company that does exactly this. And we said, you know what, as a county, we can invest in this local company to build a 100 air quality monitoring system. You can go to waynecounty.com/air quality and get real-time air quality in your local community. In fact, you can sign up for a text message. That helps us do two things. Number one, to your point, right, it helps us collect systematic data to actually understand how big the problem is at a finite local level. But then the other thing it lets you do is it gives you information that you can use today if the air quality is poor.
All right.
And
so, look, I mean, I could talk about air quality, environmental justice is our thing. I love this conversation, but I want to make sure we have a chance to get to why you're running for Senate.
Yeah.
And what specifically you plan on doing as a senator if elected.
Yeah. We all know the absurdity that is being waged out of the White House. And I don't even want to sully our podcast with his name. And a lot of focus has been who can stand up to him, right? I got receipts on fighting big fights. Anybody knows me knows that I don't back down. But it's not just about what we're fighting against. It's about what we're fighting for. And I think too many folks, too many Democrats are willing to take that corporate money from the very same people who have created the challenges that we've been talking about all day and then come up with some message that's just a little bit better than what Republicans tell you and expect that that's actually going to change our politics. And I don't play that game. Right? Folks might remember I ran for governor back in 2018. I didn't take corporate money then. I won't take corporate money now. I'll never take corporate money because my sense of it is that you've got to be willing to talk about the challenges that real people are facing and the big issue in our politics, right? And I said this back when I ran, but I think folks weren't ready to hear it. Donald Trump is not the disease of our politics. He's just the worst symptom of the disease. So if you want to take him on, it's not enough to just beat him. You also have to rethink the system of our politics that has been essentially corrupted in the ways that billionaires and corporations can buy off politicians to do their bidding. And here you look at the Blue Crosses, Blue Shields of the world, you look at the DTEs of the world, spending hundreds of thousands of dollars to buy access to politicians and lobby for the policies that'll help them. If we're serious about taking on our politics right now, you've got to be serious about fighting for things like Medicare for all, eliminating medical debt, being able to take money out of politics and to make sure that you're standing up for union rights and the opportunities of small businesses. And so I think that fight has to happen at the federal level. I think it means being willing to represent our communities in an authentic and a local kind of way. And it means being willing to rethink the fundamentals of our party politics in the way that we are in this campaign.
Well, Alyssa Slotkin is in Lansing, in D.C., and she's not being silent. She actually has an economic war plan.
Yeah.
Tell me, how do you differ? How does your plan differ from her economic war plan?
If the subtext of my politics is probably a lot more about healing than making war. And I think the other part of it is...
she's CIA, and that's her proud accomplishment, and also being a soldier, so I can understand why she chooses warfare.
Yeah. I'll tell you this, right? When it comes to where I think our politics need to go, I think we need to be addressing consistently the pain that people feel in their lives. We need to address it by virtue of a very honest assessment of what has gone wrong with our politics and why our system doesn't seem to be working for people and how it might. And so for me, the way in which the most powerful buy off politicians, that to me is the essence of the issue. And so where Donald Trump, to his credit, has been very, very good at identifying people's pain and responding to it in some way by demagoguing either the radical left or immigrants.
That's what demagogues do.
That's what demagogues
do. It's like your narcissistic ex, right? Who can read your mind and understand all your pain points and use that to manipulate you, gaslight you and everything. And then, it takes years of deprogramming. Not that this has ever happened to me, but just in case any listener has ever been with a narcissistic ex, that's who he is. He's a malignant narcissist, and he does to the nation what an abusive spouse does to somebody they're married to.
That's very well put. I think the hard part, though, is because he sees people's pain, Democrats have responded by being opposed to him rather than also articulating people's pain and coming up with real solutions to solve it.
Well, not all Democrats, though, right?
Not all.
So you have the Our Revolution folks. Are you part of that?
We were glad to be endorsed by them back in 2018 when I ran.
Okay. Yeah. So this is, and I didn't agree with everything, right? Like I don't agree with this mindset that we have to that caring about the needs of Black and brown people is identity politics. I look at white supremacy as identity politics. Everything else is just survival, right? But Our Revolution is an example of a movement that looked at people's pain and has been marginalized by the larger party forces.
Yeah, I think that's exactly right. And Our Revolution was birthed out of Bernie's 2016 campaign. And I'm honored to be running with his endorsement now in 2025, 2026. But I think to your point, right, what we're building is a movement founded on the pain of people with an answer that speaks to the ways that too much of our lives has been monetized by big corporations in ways that leave us getting paid less and paying more for the basic things we need.
All right, so let's talk about answers. All right. What are we going to do about housing?
Look, I think, there's a couple things. Number one, you got big tech corporations like Vrbo and Airbnb that have enabled people from faraway places to buy housing, driving up the cost for everybody else. And I think we need to get serious about regulating big tech generally and them specifically. Two, I think we need to address the fact that we have not invested in the ways that we need to in systematic, affordable housing that is integrated across all of our housing stock. I think three, we need to be thinking about the ways in which zoning empowers local developers over everyone else to build the kind of housing that people can't afford in the first place. And then finally, four, I think we need to be serious about rethinking where we subsidize in the housing system. We've been really focused on making sure that people can afford to buy homes, which we should continue to do, but we also need to be thinking about making sure people can afford to rent as well.
You're right. I mean, fewer and fewer people can afford to buy homes now. Yeah. And the interest deductions on taxes far exceed what we spend on, public housing or on housing for low-income people. So I'm hearing you is we've got to balance that.
We got to balance that. It's like housing is a housing problem. We got to build more housing, and then we got to make sure people have the money to be able to access it.
Yeah, and we have to build it affordably.
Right.
100 years ago, we didn't have any of the housing programs that we have right now. And so it seems like we're at an inflection point, and I'm really looking forward to some really innovative and specific solutions to what we'll do. If it's not going to be Section 8, it's not going to be public housing, it's not going to be FHA, and quite frankly, what we do is we nibble around the edges of those things, and we never come up with anything new. What are some new ways to envision what housing looks like? Social housing in other parts of the world looks a little different than public housing. So I'm interested in ideas as your campaign progresses. I think people have to be able to envision this. Like, I have to be able to see it and taste it in order to believe it can be.
Yeah. I think part of the challenge, right, it's like we, especially in our part of the state, or in our part of the country, we build out instead of building up.
Yeah.
And we got to be building up a lot more. And what happens is you can build up in ways that make it easier to access not just housing, but to access all the other things that you want to be around.
Yeah.
And I think
now in Detroit, we look like, gap-toothed sister. Detroit has so many vacant spaces. Yeah. Many Detroiters want to see more single-family homes. Are you opposed to that?
No, I'm not. I just think that part of the challenge that we have is that the single-family home system, the way Detroit was planned, is it was planned in almost entirely around having to get around by car. Mm-hmm. Right. And I think that system hasn't always benefited everybody. So I'm okay with more single family homes as part of the solution. I'm just thinking that when you look at the preferences of younger folk, there are opportunities for us to kind of rethink different neighborhoods around how you get access to the things that you need without necessarily having to get in a car and go get it.
Yeah.
And so more single family homes is certainly part of the solution. If for folks for whom that's the preference, great. I just also think that we need to be thinking about urban planning in ways that allow us also to build up and to get the same kind of creature comforts that you expect from a single-family home in a multifamily space.
In a lot of the spaces that we're building, you're building a lot of studios and one-bedrooms. We're not really building family-sized housing.
Yes.
So I would imagine changing. I have to be honest. I was just in L.A. visiting my son. For his 30th birthday. He turned 30th on June 29th.
So he's a year older than you are. That's fantastic.
Yes, that's right. He was thinking about me when he was born, right? We're in his apartment building, and, he's in a one-bedroom apartment. But the reality is the building has so many living spaces above and beyond his apartment. I've lived in apartment buildings before, but nothing like this.
Right.
And so what I'm hearing you say is that we can create places where the living room is not necessarily in your home, or the party room is not necessarily the game room, and certainly not the swimming pool.
And even then, you can imagine, so when we think about apartments or condos in Michigan, because we've been so focused on single family homes, we think of apartments as a certain kind of housing for a certain kind of person, right? So we build studios and one-bedroom apartments. But if you rethink what these spaces can be, you can imagine building in a lot of the kind of space that you would expect in a multifamily home, in a single-family home, in a multifamily unit,
absolutely,
in a very diverse kind of building.
You know, if you go into Palmer Park, for example, a lot of those apartments are large family-sized apartments. But while we were visiting him, there were many people there who were families in the pool, little kids. And so I saw, and it's like, wow, there's 2 and 3 bedroom apartments. His is a 1-bedroom. But you have that diversity. Yeah. And I think, one of the things some people talk about is having homes that can accommodate people's needs from cradle to grave.
Right.
So that even the seniors have a place within that community. All right, we're going to take another break, and we'll be right back. Talking about your Senate run, I want to get back to some other ideas. We talked about one, which is housing. We had conversations a couple years ago about water policy. Yeah. And the mayor rolled out the Lifeline program, and the Lifeline program is on life support now. And so pretty soon, people's water is going to be shut off like it was before unless we come up with another solution. Is water a human right?
Yes.
And if so, is there a role for the U.S. Senate in protecting that right?
Yes. And it's a crazy thing that in a state that's surrounded by 21% of the world's fresh water, that we have affordability issues here in the city. I think the state legislature had an opportunity to solve this problem. The fact that they did not is terrible. I do think that there is a role for federal policymaking to guarantee water accessibility and affordability in this country. Is what are we without water? And I think we've got space coming from the experience in Michigan, whether it is water affordability in Detroit, or it's the Flint water crisis in Flint, or it's PFAS plumes in spots all over the state, to step up and lead on what water affordability, so accessibility, affordability, safety, and purity can mean, leading from a state with some authority on both water issues and also water conservation, given the surroundings by the Great Lakes.
I was going to say water is another example where you have rights and also responsibilities, right? We have a responsibility to protect this freshwater source and the right to access fresh water for personal use. Maybe it's not all the water we want to use for anything we want to use it for, because we do waste water.
Yeah, and
many people do.
When I ran in 2018, obviously I was running for governor, where you have a little bit more opportunity to sort of tailor specific policy. We ran on guaranteeing the basic amount of water that any family would need to be able to cook, clean, bathe, and make sure that you can drink. And then you would charge a little bit more for additional water. So if you want to water your lawn, the cost of that water, it's okay if it's a little bit more expensive. If you want to fill a pool, it's okay if you're paying a little bit more, but the basic amount that everybody should have for their basic daily needs, that should be covered. And we can do that again. Like anybody who tells you that in the richest, most powerful country in the world, that you have to charge people for water or drainage, is not actually paying attention.
It's so stupid. We treat water as if it is a resource,
a commodity.
A commodity, yeah. Thank you. I was trying to think of the word for that. We treat water like it's a commodity and not like it's a resource worthy of protection. Mayor Pingree was actually in favor of free water, right? And I think beyond that, I've been talking to people, and very few people say, well, somebody has to pay for water. Well, somebody has to pay for roads. Somebody has to pay for police service and fire service and just public lighting, and all of those things come out of tax dollars, not out of rates. And the problem with a water rate is that a flat rate is regressive, right? If I'm rich, the water rate means nothing to me, but if I'm poor, it means so much. Yes. It feels to me as though the rate should be tethered to ability to pay. And the current mayor, who's running for governor, says, well, you can't do that because there's a Bolt decision in Lansing that stops that from happening. But it's never been tested, right? You can't tell me that you believe in me having rights and then you don't test the law to see how far you can push it to grant me those rights. Now, if the mayor tested that, I would have been in one position, but, since then I've been in another. Okay, so that's water. We've talked about environmental justice somewhat, right? But I want to say something else about water. The Colorado River. All of the draining of aquifers in the Pacific Southwest is really damaging and scary to me. Because the rivers and lakes are, shrinking or they're declining. But it feels like there's very little federal protection for that. And this current president is doing everything he can to unprotect every resource in the United States. So anyway, other things that you're running.
Let me comment on that real quick.
Okay.
Sustainability is a real thing.
Yeah.
Like whether people want to admit that you need to be thoughtful about how you use your resources, everybody in their life knows that if you use too much of a thing, it goes away. And when you do it on a grand scale, it's a lot harder to make up for in the long term. And part of the way that we as a society have addressed unsustainable situations is to invest deeply in research that helps us to unlock new opportunities, right? Like there is no reason in America in 2025 that we shouldn't be investing deeply in desalination research, or that the Southwest should be draining a very, very limited resource in the Colorado River when instead you should be able to desalinate like places like the Pacific Ocean.
Absolutely.
Now, look, I know that might be in the long term might run into its own challenges, but like the idea that we're not invested in more research and we're pulling back on research investment in a time when they're making deeply unsustainable decisions makes zero sense to me. And that's a place where federal policy really matters.
I remember there was a 13-year-old kid in Africa who was able to desalinate water.
Yeah.
And it made the news, and so you take it to the next scale. But it feels like this president is targeting research universities and research because not only does he not want the federal government to invest, he doesn't want these things to be done.
Yeah.
So crazy to me. Okay, so we have that. We have the environment. And I want to hear about the environment and healthcare.
Yes. So let's start with healthcare because that happens to be my jam. So I literally wrote the book on Medicare for All. I have a very clear and succinct grasp on what the challenges in our current healthcare system are. Right now, unfortunately, we spend nearly $1 in every $5 in this country on healthcare, and that cost is going up. To compare that, in places like Canada, they're spending just a bit more than $1 in every $10, right? And for that, we are getting a system that has huge holes in it, where you have multiple classes, where there are some people who can't get high-quality healthcare, and there are some people who can get as much of it as they want. And we're in a situation right now where they're about to strip it away from even more people because of this big ugly bill, right? You're watching as Medicaid is going to get gutted, rural and urban hospitals are going to get destroyed.
But that's 2026, right? So they very cleverly kick the can down the road so that people will not feel that pain at the midterms. I would imagine in your run, you're going to let people know what's coming in December, right?
I mean, absolutely. And also, I'm going to be running against a Republican, highly likely, who's voted to raise the price of your prescription drugs 60 times. I'm the guy who led the effort to eliminate $700 million in medical debt. So when it comes down to it, right, it's not enough just to get Medicaid back. Yes, of course. But also, we should have access to healthcare for everyone, guaranteed, regardless of whether or not you turned 26 or got married or got divorced or got a job or lost a job or turned 65, all reasons why you can lose your healthcare in this country. You should have cradle-to-grave healthcare guaranteed for you without the worry of having to pay a premium or a deductible or a copay. It should just be there for you. And in the richest, most powerful country in the world, what they just showed is that they don't actually care about budget deficits. Right, because they just blew out the national debt another $3.5 trillion to give billionaires a
Republicans
tax cut.
always explode the budget deficit. They run against Democrats, criticizing Democrats for the budget deficits, and then they exploded. The manipulation of this party is nothing short of sickening. But yes, I agree with you that we need to do something different. And I really hope that we can take on healthcare as a human right?
Absolutely.
Because as advances come in human knowledge and in our understanding of the world, those advances should be shared freely among people. It shouldn't be hoarded for those people who can afford to pay. It's shocking to me that in a nation that calls itself a Christian nation, people don't believe in Christ. But let's move on to the environment.
And this is the place where I think these things all connect. Right now, we have a sick care system, and all the incentive in the system is to wait for you to get sick and then charge you up the nose for having gotten sick. We can and should and must invest in keeping people healthy, and part of that is keeping the globe healthy. I think oftentimes when we've talked about climate change, it's been talked about as an issue happening over there, right? Like the picture you see is of a polar bear. And let's be clear, none of us see polar bears. What I want folks to think is that every single greenhouse gas that we emit gets sieved through the lungs of our children. and it makes them sick as it goes out to the atmosphere and makes the globe sick. And we're watching as, rainstorms, right, come out of nowhere in Texas and swallow whole communities
26
alive.
inches in 45 minutes.
It's insane. But that kind of thing didn't happen all that often in the past. We're setting records for the hottest days, right? And let's be clear, every time it gets that hot, many people die.
Well, this is one of the things in my class that I've been teaching that I talk about is that you may not live near places where the air is being polluted, and so you don't know it's being polluted. You may not live near places where the water is dirty, so you don't know the water is being polluted. You may not live near places where there's, pollution on the land that has all the legacy pollution that's in our communities. But there's one air, there's one water, and ultimately one soil because pollution travels. And so the challenge is you cannot insulate your kids from what's coming. Not really. Even if you don't smell it directly. I mean, when Stellantis was expanding, the folks in Grosse Pointe were worried because they understood we're not that far from there.
Right.
So
that's exactly
how
right.
do you get that message out?
I think part of it is let's be clear. The reason that we are stuck where we are when it comes to this is because corporations haven't been forced to bear the cost of their pollution. And they've done this by using arguments about two things: that they create so many jobs, or that the willingness to hold them accountable is going to increase the cost of our electricity. And so there's a couple things we need to do. Number one, we need to take their influence out of our politics. And number two, we need to invest in research that ultimately buys us out of any sort of energy question that exists. And number three, we need to fight for fair unions. And so you do those three things, and at some point, the notion that we're burning stuff out of the ground into the lungs of our babies to destroy our earth becomes so unserious and illogical and ridiculous that it is self-indicting.
I have just one point, and we do have to wrap it up. The Stellantis plant that's poisoning our community. It's not the engines that are causing the poison. It's not the, welding. Those aren't the things that are happening. It's the paint. In 2025, we are using paint that makes people sick. As if we don't know how to manufacture non-toxic paint.
Yes.
There are countries in the world that regulate what kind of paints can be used on vehicles that are manufactured there. Maybe the paint is not quite as shiny. Maybe it's not quite as durable, but people live.
But you know what it's really about? It's about expense. It's that it's less expensive to use that toxic paint. And it's bad for workers. It's bad for the community.
Yeah.
And it's unnecessary. And the question is ultimately one of, are we willing to force a corporation to spend a bit more money to protect the health of its workforce and its community?
And sometimes it's a matter of enough money, a bit more money now, not continued money, because eventually the cost will level off. I'm so glad you brought up workers, because people get mad at workers in some of these places, not understanding that if we're smelling this stuff out here, they're working in those conditions, and it's even worse for them. So when we say we're trying to protect a workforce, I remember when Rashida Tlaib came here when this was first planned. She spoke at an annual meeting, and she said at that time that people cannot work while they're dead. And so we have to look at keeping people alive. We have to look at the fact that we're actually killing people, and people's lives are foreshortened by all of these systems of injustice. So how can people get in touch with you for your campaign? How can they support you?
So I hope that folks will go to abdulforsenate.com. They can sign up to volunteer. They can sign up to donate to the campaign. They can also follow us on social media. We're on all the major platforms: TikTok, Twitter, that other place, Instagram.
How about Blue Sky?
We're on Blue Sky. You can follow us on YouTube. We're everywhere.
Substack? Do you have a Substack?
We have a Substack. We literally got everything. So
Okay.
I hope that folks will choose where they want to follow us. Hopefully several. But we're having conversations that are, I hope folks will find, refreshingly honest and direct and specific about what needs to happen and how it needs to happen. And we cannot do this without folks themselves deciding that they want to be a part of a movement for something bigger. I don't take corporate money because I think it's essentially what's wrong with our system, is that too many politicians get bought off by corporations and then get told what to do when they're in office. That's not what you'd be electing me for. And so I am hoping that I can build alongside you. You can join this movement, and I hope that folks will go to abdulforsenate.com.
All right. Now, when you go to listen, you're having listening campaigns all throughout the state, and I imagine you're going to listen on the East Side one day?
Yes, ma'am.
All right. You'll let us know when?
We will.
Okay. Well, I want to thank you for joining us today. Do you have any shout-outs today? It's time for shout-outs where we, just recognize and highlight a person who's done something great.
Given that we're in Detroit today, I want to highlight somebody who folks probably have never met, who is an organizer out of Sault Ste. Marie named Chloe Cannon. And the reason I shout out Chloe Cannon is because Chloe is a member of the Sioux tribe out there, and went to all of the most prestigious schools, and then made a commitment to an elder that she would move back, and she did. And I got to meet her when I was up there, and it was one of those experiences where, in sitting down and listening to the challenges that elders talked about, that young people talked about, I could have closed my eyes and I could have been in Detroit. I could have been here on the East Side. And Chloe opened my eyes to that problem, reminded me yet again that the challenges that working people who have been locked outside of our politics face are the same, whether you're talking about Sioux tribal elders or elders at the church down the street.
What would be really interesting is if you can bring groups of people together to listen to each other so they can hear it from each other, not just from you. I think that would be an interesting campaign approach.
I love that.
Yeah.
I love that. We should do it. In the spirit of podcasting, I feel like, in the year of our Lord 2025, we have the technology for that. So I appreciate that, Ms. Donna.
Absolutely. I think that there's ways for us to listen to each other and, in the spirit of my grandmother. And I suppose I will recognize her. We were in the federal court today, and my sister presided over the immigrants. And, she raised a picture of my grandmother. And so in the spirit of my grandmother who invested in me, a sense of justice and connectedness of human beings and this idea that God loves all of us and we shouldn't pick and choose. I think this is a year for solidarity. I think this is a year for bringing people together and saying we together don't like injustice, so that next year during your, I'm sure, vicious Senate fight, because you're running against a Democrat as well, right?
It's going to be a pretty intense Democratic primary.
And she's made some pretty disappointing decisions lately. To some of us, but we don't need to get into her. But you're not running by yourself. It's going to be intense. Hopefully, we'll still see unity in that process. We will not be divided among ourselves in the way that we've allowed ourselves to be in the past.
Yeah, I agree.
So, listen, if you have topics that you want discussed on Authentically Detroit, you can hit us up on our socials at Authentically Detroit on Facebook, Instagram, and Twitter. Or you can email us at authenticallydetroit@gmail.com. Thank you so much for listening. Love on your neighbor.